Hi everyone, welcome to Chapter 11, Treatment of Psychological Disorders. In this chapter, we're going to cover a lot about how we help people with different psychological disorders and talk about some different specific ways in which we do that. And we'll get into kind of how there are lots of different or multiple different approaches on how to solve this problem. All right, so let's go ahead and jump into it. So Chapter 11, Treatment of Psychological Disorders. So the first question we need to ask ourselves is generally just what is treatment? So what are we actually doing when we talk about treating different patients? Well, there's a couple different approaches or angles we can take this from that we can try to help people in how we are treating their psychological disorder. And so we're going to talk about a few of these and kind of dive into each of these different approaches. But generally speaking, when we go through this, I want you to kind of be aware of a couple different things. So I want you to be able to distinguish between some different basic approaches of treatment, that being the pharmacology or basically the biological or medical side of how we approach treatment. Think medications for different disorders, and the psychotherapy or the psychological side of how we treat disorders. Think different strategies and tools and ways that we can kind of approach a problem mentally or cognitively to try and approach it or improve upon it in different ways. So these two things kind of go hand in hand, and we're actually going to talk about a third piece of this puzzle as well later on, but these two things go together and we can kind of solve or approach this problem from both angles. And sometimes we can solve this problem with one of these approaches. Sometimes we might need both of these together to really be able to alleviate or improve upon someone's life. I also want to talk a little bit here about who actually provides different types of treatment for patients with psychological disorders. Let me go ahead and jump out of the way. So when we look at this table, we can kind of really see the different jobs and the different roles that people play in helping patients with these conditions. So first off, I want to kind of point out the different job titles. So we have psychiatrist, psychiatric nurse, psychologist, clinical social worker, and a therapist. And you'll notice that each of these hold a slightly different degree, and that degree kind of affects how they approach solving these problems. And so, for example, a psychiatrist is someone who actually has a medical degree, and that medical degree not only allows them to treat patients with psychological disorders, but also allows them to write prescriptions and treat them from the pharmaceutical side as well, with medications and prescribing things like that. It's interesting also to point out that psychiatrists go through medical school, and in this process, they choose to specialize in the field of psychology. So they have a full medical degree, but they've just specialized in the area or field of psychology. We also have psychiatric nurses, who are someone who often have medical or nursing degrees, and they're also able to kind of work with medications, oftentimes able to prescribe and manage different psychiatric medications. So these are the only roles that can actually treat patients from the pharmaceutical side or utilize pharmacotherapy to actually improve patients' outcomes. Then we have psychologists, and these are people with doctoral degrees or PhDs, sometimes PsyDs as well, and they often diagnose and treat different disorders, but more focused on the psychology side or the psychotherapy side of things. We also have clinical social workers, which often have master's degrees, and these people will look at a lot of the times sort of the social side of this equation, and this is that third piece that we haven't really gotten to yet, but we're going to see here in a minute, that also kind of provides support and structure to someone's life to improve upon their outcome. And then lastly, we have therapists who, again, have master's degrees, and these often are people who can assess and treat psychological disorders utilizing a more standard approach, and often they are just performing different tasks that have been studied by someone like a psychologist with a PhD who actually performs research to uncover new tools and strategies, whereas a therapist just employs those while assessing and working with a patient.